we can't keep up to the call volume in Brandon.
Ambulances in rural Manitoba continue to sit idle due to staffing shortages, and in Manitoba's second largest city, staffing is stretched to its limits as they're now responsible for emergencies in some surrounding areas. Brandon currently has 2 fire halls, both accumulating a minimum of 10 staff members. Terry Browett, president of the Brandon Firefighter Paramedics Local 803, says staff are overwhelmed and burnt out.
It's one of those things you don't see until it catches up with you. And it's having an effect on our staff, and to the point where, like I say, we're just not able to fill any of this overtime anymore.
Call volumes in Brandon have increased 57.4% over the past 10 years. Browett says when he started working 25 years ago, they received fewer than 3,000 calls a year. Fast forward to 2022, call volumes are over 7,000. And to make matters worse, the city of Brandon still only has 2 ambulances.
Once I seen the amount of hours that they're running short in these communities, it's starting to make sense to us why we're responding to these areas now.
On Thursday, the Manitoba Association of Healthcare Professionals released drastic numbers from an internal report where ambulances were out of service and unavailable to assist Manitobans in an emergency for a combined total of over 17,000 hours in 1 month. Bob Moreau's, president of the MAHCP, says the province continues to ignore a significant staffing crisis.
It is so demoralizing. We're all really worried for what the system is going to be looking like in the near future and in the long term. People are seriously considering leaving the profession when they should be at the peak of their career because of the way they're being treated right now.
City News spoke to a rural Manitoba paramedic who was asked to remain anonymous due to fears of repercussions. They tell City News the situation is terrible. The morale of paramedics is the lowest they've ever seen it, going on to say that this is the start of a system collapse. Quote, "It has been very frustrating where paramedics are working 24-hour shifts regularly trying to keep trucks in service. It feels like a sinking ship, and we are using a teaspoon to bail water." A spokesperson from Shared Health said in a statement that efforts are underway to recruit staff, but Browett says this has been a problem even before the pandemic and there has been no action. He is calling for immediate support, including a 3rd ambulance in Brandon.
That 3rd ambulance would not only take the pressure off of our own calls within Brandon, but would also allow more fire staffing available for our fire response as well. So it kind of take care of 2 things there. It's getting to be a public safety issue that we can't keep ignoring and pretending that there's no problem.
In Winnipeg, Alex Karpa, City News.